Hey guys, Dr. Ben here, F8 Well Centers. Excited today to answer questions. So this is going to be a live Q&A going over anything and everything you got. I mean, as long as it's health related, that will be great. But even anything else, maybe I won't get into politics a whole lot, but let's get into it. We've got lots of questions, lots of people that are having health issues. And if you're one of them, pop that down below. I'll give you recommendations. I'll give you ideas. Remember, I'm not giving you true medical advice. I'm just giving you ideas of what we see with patients, what we would do if it was me. You always talk to your medical provider if you've got questions. If you're on medications, don't just stop a medication without talking to the prescribing physician. But otherwise, go ahead and pop those questions down below. Anything and everything. So why would someone store carbon monoxide in their bodies? That's a great question. And the first thing is, there's got to be exposure of some kind. So there's carbon monoxide and there's carbon dioxide. Carbon dioxide is going to be the waste product from energy metabolism. So when you're making energy, ATP in the body, you're making carbon dioxide. Carbon monoxide is going to be usually just coming in from a gas stove that's leaking. That's actually what those people down in the Bahamas died from. And so very good chance that if you're storing carbon monoxide, you're getting exposure somewhere. So first of all, get a carbon monoxide detector and start checking that as well. Jane, good to see you there in Vancouver. And mono Epstein-Barr virus in teens. So here you go, Anne. There's two things we look at with Epstein-Barr or mono. One is this immediate case, this case of, okay, I've got Epstein-Barr, I'm 18 years old, 15 years old, 22 years old, whatever it is, I'm tired, it's the kissing disease, all of that. And then somebody gets better and they have to take a semester off of college or whatever it is. Usually that's because their immune system's a little bit depleted in the first place. And then the second part of Epstein-Barr virus that we look at is this chronic or recurrent. I just had somebody yesterday, we reviewed their blood work and we were looking at specific markers for viral infections. Their liver enzymes were elevated. That's a sign that it could be a virus. Their white blood cell count was depleted. So if your white blood cell, your WBC on your blood work, if that was depleted, if it's less than 5, and then your lymphocytes are greater than 38, that's a really good idea that you are having some issues with Epstein-Barr or any type of chronic virus. But that chronic virus is going to lead to a lot of fatigue. It's actually going to lead to potentially autoimmune in some people. It's going to be reactivated post-COVID in a lot of people. So a lot of different things can come about. But here's the deal. There's no amount of lysine, no amount of antivirals that are going to fix this. You've got to get your body as strong as feasibly possible. When we're talking about Epstein-Barr virus, when we're talking about chronic virus, it's really about that immune system has to be as vibrant and healthy and just really going as much as it possibly can to be able to fight off all of these different things. So you've got to get that body as strong as possible. If you have not done a complete blood test, let us know. We can get that drop shipped anywhere in this country. And so from there, you've got to look at inflammatory markers, blood sugar markers, all of these different things. I'm sorry, I got that confused. It is the carbon dioxide I'm storing. I have hypothyroid, lupus. Okay, so if you're storing carbon dioxide, that's usually some type of a breath issue. So it could be a lung issue. You're probably not excreting that carbon dioxide like you need to. I would look into your respiratory rate, into lung function. There may be some issues through there. So again, bring your questions down below. Anything and everything you've got, we're going to be answering these. What would be your advice for someone who has ringing in their ears often? So if it's not actually from a damage, if it's not from shooting or something like that where you actually have damage, then you're going to have to think about a couple different things. One can be toxic burden, toxic overload. So you've got to look at the liver, you've got to look at detoxification pathways, your AST, ALT, and GGT. 3 liver enzymes should all be under 20. If it's not, your doctor is going to probably say you're fine, but that's not the whole story. You've got to dig deeper. So I would look at that. And then the other would be your electrolyte balance. You may be out of balance in your electrolytes, and that can contribute to that ringing in the ears as well. So again, pop questions down below. Anything and everything you got, I will answer those. Here's one: what to do if you have a dry cough for 2 weeks. If it's 2 weeks, probably related to some type of an infection. But if this is something that continues, then you definitely want to look more in depth into, is there damage? Is there irritation in the lungs? Anything along those lines. But ultimately, if you do get a cold, a cough, a flu, anything, and it lasts longer than everybody else, or you get it more frequently than everybody else, you need to dig deeper and figure out what your immune system is doing. Why is your immune system not keeping up? Why is it not able to fight things off like it needs to? Because really, if you get a cough, it shouldn't last for 2 weeks. There's probably something else going on. So you've got to run that in-depth blood panel, look at inflammatory markers, immune system markers, adrenals, thyroid, autoimmune, all types of different things. All right, here we go. How much caffeine pre-workout powders is healthy for a person each day? What is it about? 50 milligrams that they'll say for like a cup of green tea, up to like 100 for coffee. So somewhere for a pre-workout powder, probably somewhere in that 50 to 100 range would be a max for one person per day. You want to make sure you're not getting jittery, you're not getting too revved up, not getting, oh my gosh, I'm getting anxiety, anything like that, and then you're getting absolutely too much. What is the best thing to help with bloating? So we've got a couple things that we look at. We've got bloating. It can be up under here, under the kind of under the rib cage, the stomach area, or it could be down lower. And those are actually two different types of bloating. And then some people, it's just, oh my gosh, I look pregnant. But if it's up under the ribs, kind of more the stomach area, that's going to be more, you're not digesting in the stomach, food's sitting there too long, it's going to start regurgitating, you'll get reflux. If it's getting bloating, anything like that in the first 30 minutes, 45 minutes, that is usually a stomach issue. And here's the deal. Most people think that it's too much stomach acid, but we actually have too little stomach acid in this world. And as we age and as we're under stress, give me a thumbs up or a heart if you guys are doing either one of those, aging or stressing. If you're aging or you're stressing, and that's aging over 20, 30 years old, you are not going to make enough stomach acid. So when that food sits in the stomach, it's going to start to ferment, putrefy, not process like it's supposed to. And so then we're going to have these symptoms. It's going to regurgitate, it's going to push up, we're going to have these other issues. So I really encourage you to watch. I've got some other videos about proper food combining, about not drinking fluids with your meals, about doing your meals in a relaxed environment. And those are all going to be very helpful to get you to digest better. If it's down lower, then that's a really good idea that it's more your large intestine and you've got a fermentation issue going on in there. Your microbiome is out of balance. So if it's more like an hour or two later and it's lower belly button or below, that's usually large intestine. And there's some type of bacterial imbalance, yeast imbalance, and things like that. So those things that you can take in the stomach, taking a betaine hydrochloride, that's the stomach support. Brittany, you guys can pop that one up there. We've got that available. You take one with each meal and you go up to 2, 3, 4 until you feel some burning. And that's when people start feeling better. They get enough stomach acid in there. The other thing would be to do some kill off in the lower bowel. The oregano is the best place to start. Then you come in with some more probiotics and may need to do that a couple times through. So great question. All right, we've got another one here. I have been taking Ozempic, now I'm in the hospital with pancreatitis. Will the pancreatitis go away? So pancreatitis, pretty scary, pretty intense, and it's very painful, right? You did not feel good with that pancreas inflamed. And so here's the deal. There's a very good chance the pancreatitis goes away, but you've got to calm it down. First of all, you got to figure out why you were on that medication in the first place. If it was because of blood sugar imbalances, that's going to be more of you've got to stabilize that blood sugar. You've got to get it dialed in as far as looking at continuous glucose monitoring. So if any of you out there, your blood sugar is not where it needs to be, you're pre-diabetic, diabetic, insulin resistant, anything like that at all, the best thing you can do is a continuous glucose monitor. It's a little patch, goes on the back of your arm or on your abdomen, and you're able to see all day long what your blood sugar is doing. This is how we're able to help type 2 diabetics all the time. They're able to reverse their type 2 diabetes. They can get off insulin. They can do all types of different things. And it's pretty cool just using that device. Every new patient that we start with gets one of these. If you don't have access to that, you can start doing a finger prick glucose monitoring and see what's going on in there. So the pancreatitis can go away. You're going to have to calm down the inflammation. You're going to have to work on the liver, work on the gut. You went on lots of antibiotics, all these different things. And so you've got to work through that process. But yes, it absolutely can get better. Good luck. We'll be praying for you to get out of that hospital. What might cause severe stomach pain? So again, we go back to stomach digestion. Stomach is digesting mostly proteins in the stomach. It digests iron and it digests calcium, and that's breaking down in the stomach from that stomach acid. So if in your blood work you have low calcium, low protein, or you're not breaking down your iron, those are all indications that you don't make enough stomach acid. And it's probably 95% of the people actually don't make enough stomach acid, even though most people are told that they make too much, and that's why they get regurgitation or pain. But if you have severe stomach pain, very good likely that you have H. pylori, which is a stomach bacteria. It's a bacteria, can be in the small intestine and other places, but primarily we'll see that in the stomach with that pain, and it's irritating that gut lining, causing ulcers, things like that. Check your neutrophils. If your neutrophils are over 58% on your blood work, very good chance that you're dealing with that H. pylori. All right, let's see what else we have here. Can allergies be permanently reversed? Allergies to cats, for example. Local doctor says it can be done through a series of treatments. So it depends what kind of allergy it is and how intense it is. If we have a peanut allergy and somebody's going to like die, they go into anaphylactic shock, maybe not. There are techniques where they'll give a very, very, very like tiny sliver of peanut, just enough that it's not going to stimulate that reaction, but enough that the body does recognize it. And so what we look for then is with the cat allergies, depends on the treatment. Sometimes shots can do it. There's people that do acupuncture with allergy elimination, NAET. So look that up, Google search if you've got allergies local to you, NAET. It's a Nabujapaw technique. That was the doctor that came up with it, and it's using acupuncture, and that can help remove some of these potential allergies. But here's the deal. If it's a gluten, dairy, corn, soy, some of these major food allergens, and you get rid of that allergy, it usually just buries it deeper. So I would not try to go, oh, I'm going to go clear my gluten allergy. That's probably not gonna fix it. And do you have an opinion about idiopathic intracranial hypertension? So here's the deal. Anytime we have high blood pressure in the cranial bones, anywhere at all, my mom, she actually had this, she came back from their trip to Arkansas for the winter a couple months ago, or a month ago, and she had this extreme pressure. Her eye was watering. They did MRIs, CAT scans, all these different things, could not figure it out. And I went in there, did some actual manual work, did some cranial work on her, got those sutures moving. The cranial bones actually have this flexion and extension. And if you know somebody that can do cranial work, some massage therapists, some chiropractors, some DOs, they're like MDs, but they went to, some of them go to school and they have more of a cranial sacral education to them. But anytime there's this intracranial hypertension, that pressure building up, you've got to get those cranial bones going. I'll probably do a video on this someday, but one of the coolest things I have is we take a little balloon, we actually insert it into the nasal passage, inflate it. I had one lady, she had a shunt in her brain to try to drain the CSF out. And if not, the pain and pressure was so intense. And her shunt went out and she couldn't get another one for like 2 or 3 months. So she was coming in weekly or even twice a week. We would do that balloon procedure. She could feel that cerebral spinal fluid drain out. And she was able to actually make it until that time when she was able to get that shunt. It didn't fix it, but she was able to see some other improvements there. I believe my daughter has fungal infections after her wisdom teeth were pulled, and she hasn't been the same. So anytime we have fungal infections, you have to look at, okay, is it more of a topical thing? So on your toenails, fingernails, some things like that, okay, you've got to treat that topically. But almost everybody, if they do have a fungal, do have a yeast type infection going on, look at their tongue. And I've got a picture on TikTok. You guys can look at that as well, and you'll see what that looks like. Very coated, very white, very yucky in there. And that's a really good indication that you've got this infection down in the digestive tract, and you've got a yeast overgrowth, you've got bad bacteria, the microbiome is out of balance. And so one of the first things you need to do is you need to start doing some kill off. My favorite is oil of oregano. We have one that's time release that actually gets down to the intestines, into the small intestine, large intestine, and starts killing off down there. And we see a lot of good changes from that. From there, you start bringing in the probiotics, start making these changes. Definitely stay away from probiotics for a while. That may have been what triggered it if she went on probiotics with that. Heather, just set up my new patient visit in Nashville. Excited to get started. Absolutely, Heather. That is awesome. So we have offices in Nashville, in Denver, Highlands Ranch area, as well as Fort Collins. So we've got multiple ones in Colorado as well as Tennessee. If you're within an 8-10 hour window and can drive into one of those, come on over, come see us. We can do a brain map, exam, blood work, all these things. If you are remote, if you're in New York or California or Texas and can't get to one of those locations, then we can drop ship blood work to your front door. We can review that. One of our F8 doctors can sit down with you and let you know exactly what is going on. So Heather, we look forward to seeing you. So excited. And this is Sharon. Good morning. Someone told me on Facebook that her constipation is inherited from her dad. Is that true? So here's the deal. Constipation is not contagious. It's not genetic. There's certain people. So sure, some families have way more thyroid issues. Some families have way more issues with their with cancer, breast cancer, all types of different things. But is constipation inherited? No. What I would say is that most people that have constipation, they're in a fight or flight state most of the time. You can do two things. You can do resting and digesting, and you can do fight or flight, but you cannot do both at the same time. And so her dad was probably stressed out. She's probably stressed out, whether that's, kind of how the brain is wired, and that's what we get to see in the brain map, or she inherited this stressed out state. I don't know, but I'm guessing that it is not just an inherited thing, that their colon is misformed or something like that. It's going to be more of a fight or flight response, and she's got to fix that. So yeah, be careful what you listen to on Facebook, right? Let's see. All right. Yeah. So Mrs. Hatch asking about her daughter again. She has a hormone imbalance as well and changed her diet for lost 40 pounds. I wouldn't be surprised if she had some PCOS before, if her testosterone was creeping up a little bit high, but she was probably metabolic syndrome, insulin resistance. Yeah. All right. And I've been bleeding from my nose for over 1 BC. I'm not sure. For over one, not sure, month, year, whatever, because I got my COVID shots and I had a fever and she checked. This is what we see. People that get COVID, people that get COVID shots, it creates inflammation in the body. And that's just what happens with both of those things. I don't know if it's the spike protein or what happens, but there's an inflammatory process going on in the body. So you've got to calm that down. If you're having nose bleeding, you've got to look at your inflammatory markers. You got to look at your blood sugar, your gut, your liver, all these things, and just work on your body to calm it down. That's just really where we go with it. I've gotten GERD really bad the older I get. So GERD, gastric reflux, basically, where you're getting that reflux up into the small intestine or up into the esophagus from the stomach, that is going to be, most people think, a stomach acid issue where you're not able to deal with the stomach acid. You got so much of it and just like pouring up into the esophagus. That's not the case. Most people don't make enough stomach acid. This goes against everything you've heard, and yet it is true. And the majority of people, if we can actually get them making more stomach acid, if you don't dilute your stomach acid by drinking fluids with your meals, if you don't decrease your stomach acid production by improperly combining your foods, if you don't decrease your stomach acid by eating in a stressed out environment, you're going to be able to digest better. The food will move through quicker. But if it sits in the stomach too long, that's when it starts pushing up and regurgitating. So you've got to make some changes. So yes, not drinking while eating. Yeah, that's most people don't like that one. And let's go here. Not drinking while eating. Yes. So no liquid, especially if you're having digestion issues. Some people, if they've got perfect digestion, they're doing fine, everything's good, they're not stressed out, they'll probably be okay. But do not be drinking fluids with your meals. Do not be drinking, maybe 3-4 ounces with a meal. But if you're sitting there drinking a whole glass of water, iced tea, anything like that, you are not going to be digesting as well as you should. If you have Guillain-Barré as a teen, can that virus lay dormant and affect your nervous system as you age? Absolutely. Just like Epstein-Barr virus, just like some, shingles virus, some of these other viruses, they can come back later. So you've got to do everything you can to keep your body as strong as possible. For me, I had 2 bullseye tick rings probably 10, 12 years ago. Lyme disease. Well, guess what? I've seen enough patients with Lyme. I don't want to go through that. So I went on antibiotics, probably like 3 months, tore up my gut. It'll probably never be the same. And yet I never had Lyme symptoms. But I also know that if I let my body get depleted enough, there's a very good chance that Lyme does come back inside of me. What can be done for chronic poor circulation issues in the hand and feet? Maria, great question. So circulation, first you've got to figure out why the circulation is bad. And that's the first thing you have to do. Sometimes we look at, so the adrenal glands, the adrenals are our stress glands, jobs and cars and kids and COVID and presidents and gas prices, whatever you want to stress about. And so the adrenals give tone to our blood vessels. So it's kind of like if your garden hose was made out of balloon material, you turn the hose up and the water goes, and that hose just kind of expands out and doesn't even go very far. So we know that if someone has weak adrenals, if they're adrenally fatigued, anything like that, they're not going to be circulating in their hands and feet very well. There's another thing that we look at called Raynaud's, and that's if it's like extreme. It gets white, when it gets really cold, or red. Raynaud's is actually an autoimmune as well. Very good indication that your body is attacking tissues. Could be other places also. So you've got to go through the process of figuring out what it's doing there. But ultimately, think about this. If you have poor circulation in your hands and feet, you also have poor circulation in your brain. And it has to pump up against gravity, go through these little blood vessels, cross the blood-brain barrier, get in the brain. So you have cold hands, cold feet. You also have a cold brain. So you've got to get that going. Nitric oxide is a great one. That's what we do with patients all the time as well. All right. Hey, Sharon, how are you? What causes hiccups after recovering from COVID? Current smoker and uses metformin and lisinopril daily, asking for a family member. I know that's not you, Sharon. The hiccups, man, I mean, anything, when we see COVID, we just know inflammation, and we've seen it with blood work, all these different things. So what is causing that inflammation is really going to be the big question. And if they're smoking and have the blood sugar and have the blood pressure, I mean, they're a hot mess. They're probably lucky they made it through COVID. So I mean, that same thing, Sharon, you got to run that blood test. You got to run all these markers that we do on everybody, and then just start with that continuous glucose monitoring, work on the liver, work on the gut, all of those different things. But the hiccups, it's probably inflammation related. All right, here's Carrie Reed 6. Do probiotics work? Probiotics work for some things. I mean, it depends what we're talking about working for. So if somebody just has colitis, diverticulitis, Crohn's disease, major digestion issue, and all they do is take a probiotic, no, that's not going to fix anything. What we find is that most people, we have to kill off bad bacteria first, and then we come in with a probiotic. So most people, if you just come in with a probiotic, that's not going to do it. But you also have to fix what's going on actually in the digestive tract. And if you're in this fight or flight state, you're not going to be digesting like you're supposed to. If you've got leaky gut, you've got to fix that. If you've got not enough stomach acid, you got to fix that. So you've got to figure out the whys. But just taking a probiotic, I'd love to say, hey, here's this link to this probiotic, go take it, you're going to be fixed. I'd be lying. How do I know if it is an ulcer? Thank you in advance. So how do we know if it's an ulcer? One of the things, if you take a shot of apple cider vinegar and it burns a lot, there's a good chance that you have an ulcer. If you look at your blood work, you have stomach pain. If you look at your blood work and your neutrophils are over 58%, good indication that you have bacterial infection going on in your body, and you need to do some kill off some H. pylori, and it's probably an ulcer at that point. But the biggest one would just be to take at least a tablespoon or two of apple cider vinegar. If it burns, you probably have an ulcer. Hey, Jersey Joyriders, what about ox bile? So if somebody is missing their gallbladder, so a lot of people have had their gallbladder removed. Give me a thumbs up, heart. If you've had your gallbladder removed, there's a lot of people like that out there. Then you need some type of bile support, and ox bile is definitely going to be one of those. Bile salts, bitters, some of these different things are going to be helpful for making sure that you're breaking down your fat. So remember, the liver produces bile stored in the gallbladder, secreted when you eat a fat, released when you eat fat, and breaks that down. And so what we look at then is if somebody has had their gallbladder removed, still aren't digesting like they need to, they probably need some ox bile in there. Hey, Patricia, good to see you. I was just up in Montana by Great Falls. Beautiful, beautiful country. And after struggling to find an answer to glutamate tolerance, do you have a test for that? There are tests for the glutamate intolerance. A lot of people, just if they eat things with glutamate in them, they usually know that, and they don't need to. But yes, it can be tested. The bloating can cause breathing difficulty too. It can be pretty intense at times, Glenn. So yeah, if you're bloating up enough, it can push into your lungs, and you can't even breathe as well as it should. But that's usually, again, a digestion issue. We had a question here, Melanie Martino. How do you know if you don't have enough stomach acid? That's one of the ways. If you're getting this gas bloating, if it's sitting there too long, if within 30, 45 minutes you're getting this indigestion, food's just sitting there, you are not going to be digesting like you need to, and you probably don't have enough stomach acid. But here's the deal, Melanie. If you're stressed, if you're aging over 30, 40 years old, you are probably not making enough stomach acid, and you need to do things to give your body the best chance possible. Proper food combining, keeping your proteins and starches separate at meals, not drinking fluids with your meals, as well as eating in a relaxed environment. So don't eat at your desk, don't eat on the computer answering emails. Go sit, look out at the sun, and just relax as you do that. Mama the Great, no gallbladder. So Oxfile, yes, especially if you're having digestive issues, you need that. Had gallbladder removed and throwing up daily since. This is Stardust, 6 months long. Sorry about that. That sounds horrible. Nobody likes to throw up every day. Just saw a patient yesterday. We finished up our 6-month program with her, and she literally was throwing up every day when she came in. Now she's not. She feels great. She's down 30 pounds. She calls me her angel, and she's going to live a whole lot longer and happier because of everything that she's done to her body. So yes, you can look at Oxfile, but ultimately you've got to take a step back, get the rest of the digestion work, and do that blood kit. If your doctor won't look at your GGT, won't look at your blood sugar markers, won't look at all these other things, then drop us a line. Click that link in the bio. You can schedule a calendar invite. You can schedule a discovery call, and we can sit down with you and talk to you about what you have going on, what drop shipping that blood kit looks like if you're not local, and how we can get better. Let's see. Is Oxfile safe for me with no gallbladder, but I have EOE? That's I'm not going to give advice on that one. That's a little bit more complicated, Cara. EOE, that's where the esophagus is inflamed, some irritation there. So that would be a little bit more, I would need to know the whole history before that. Cositer, I have so many questions about my issues. Well, get going. Only one way to get them started. Let's see here. And hey, Paula, good to see you. All right. I've been feeling anxious and anxiety and hard to breathe. Yeah, that's no fun, right? Nobody wants to feel anxious. No one wants to feel anxiety. That hard to breathe is we'll feel this pressure. Let us know. Anybody else have ever had a hard time breathing when they get anxiety? So 2 things when you think about anxiety. One is you need to get a brain map done. And a brain map is a quantitative EEG. We put the cap on somebody's head. We're able to detect the electrical activity. We can totally see, is there anxiety in that person? We've got a patient now. She literally has been out of the house maybe a dozen times in the last year because of this anxiety of she's had some GI issues and emergency diarrhea, and she's so anxious. We're 6 sessions now after doing that brain map, 6 sessions into neurofeedback, and she went to a movie the other night for like 2.5 hours and wasn't freaking out. She's like, oh my gosh. And this is after going through all types of work to fix her gut and all this, and the anxiety did not go away. Now we're doing neurofeedback, and that's the best place to go. Number 2 thing to think about with anxiety, especially random anxiety, is blood sugar swings. So what happens is as that blood sugar crashes down, the adrenals are stimulated. The adrenals are our stress glands. They respond to all types of things, jobs and cars and kids and COVID and all kinds of stuff, but really to low blood sugar, then those adrenals kick in, the liver releases glucose, sugar, but then we've got adrenaline flowing through it. So I've had teenage girls that are sitting at school texting mom, oh my gosh, I'm freaking out, I can't handle this, and just really be intense. So absolutely, you've got to dig into the why of that anxiety. That is definitely not going to be just a fix from taking a supplement, or definitely not from a medication. It's not a lack of Xanax. All right. Can I do a guest request? Yeah, go ahead. So Miss Ladybug, are you a medical doctor? So here's the deal. I did not go to medical school. I went to a chiropractic university, and actually every one of our F8 doctors has their DC, their doctor of chiropractic. And the reason we do that, the reason we hire those, not just because that's what I'm familiar with, but it's the philosophy that's the big difference here. And it's the philosophy of the body can heal. So in the chiropractic training, they're doing adjustments, all those things. And the idea is that the body can heal from the inside out. In the traditional medical training, it's an outside in. You need a surgery. How many people have had their gallbladder removed? Tons on here. You need a drug. You need to block an enzyme, inhibit a receptor, all these things. And it's an outside in. But we know that the body has the ability to heal. My mom healed from MS. She had a wheelchair. She had a cane. She was on medication, all those things. She's been free of that for 20 years. She's 79 years old. She does granny boot camp, takes my kids fishing, all of these things because her body was able to heal from the inside out. So it's a whole lot easier to teach someone the functional medicine model than it is to unteach somebody this model of outside in. Even if somebody's doing natural stuff and they're in that philosophy of outside in, they're like, hey, you're not sleeping? Let me give you some melatonin. Oh, you can't digest? Let me give you enzymes. Instead of let's fix the systems that are out of balance and give the body a chance to heal. And that's the most important part that you can do, is give your body this potential to heal. And yeah, I have Chiari. This is me cheese. I have Chiari, which is that pressure in the cranial bone. I'm wondering if I have a CSF leak. Yeah, if you have that going on and you have not been evaluated, have not seen a neurologist or somebody yet, I would highly recommend go getting that. Brondo, food combining. Okay, let's get into this a little bit more. Proper food combining. This is going to be one of the best things you can do for digestion. And so proper food combining is going to look at keeping your proteins and your starches separate. So you're going to keep those proteins and starches separate, meaning if you eat some chicken, you're not going to eat rice. And this is especially for people that have reflux, bad digestion, bloating, all these things. It's a simple thing that you can start doing. But here's the problem, is that most of the traditional American fare, eggs and toast, turkey sandwich, hamburger on a bun, spaghetti and meatballs, Mexican food, all these things have protein and carbs together, protein and starches. So you want to keep those separate each meal, chicken and broccoli and avocado. Or if you are going to have some rice, you would do it with some vegetables and some fat, but not with that protein in there. And those are going to digest better that way. So people are like, well, how long do I have to do it? At least 30, 50 minutes separate. And here's the other kicker. You want to keep fruit in between those meals, not with those meals as well. So don't eat an apple with your chicken salad. That's not going to digest very well either. But if you're having digestion issues, try that out and you will see some nice shifts there. Yeah, and I've been on Prilosec for about 4 years. Is that bad? So here's the deal with taking any type of antacid, anything that's going to suppress stomach acid, PPI, anything like that, is that then we need enough stomach acid to actually break our food down properly. And then by the time it gets to the small intestine, large intestine, it needs to be in its proper state. But if you're taking medication for years and years and years to suppress that, you are inhibiting your digestion. You're probably not getting enough calcium. You're probably not getting enough iron. You're not breaking down your protein, all of these different things. So I encourage you to figure out the why that you're having. Whatever medication you're on, figure out the why. Take the least amount needed to get the desired result. I'm not saying to go get off of it. You need to talk to your doctor about that, some of those things. But if you fix the why, if you get yourself better and you're on a blood pressure medication and you can get off and your blood pressure stays the same, you don't need to be on that medication anymore. So take as little as possible. Hey, Brianna, Maria, help. Let me know what's going on. All right, let's see. And this is Sunny. My girlfriend is always so tired, has had several labs pulled and everything is coming back normal. She has COVID twice and got the booster shot and caught COVID after the shot. Unfortunately, that's what we're seeing a whole lot, is that even getting the boosters, people are still getting the infection. So it's really not doing what it needs to do. But your body can. So I would say this, especially if she's had COVID, I would run a blood work test look at her white blood cell count. If her white blood cell count is under 5, if her lymphocytes are over 38%, and even if her liver enzymes are starting to creep up over 20, AST and ALT, there's a good chance that she has a reactivated viral infection. Could be Epstein-Barr, something along those lines. So I would look into that. If it's not thyroid, if it's not diabetes, anything else extreme, it is probably going to be some type of virus. Could be Epstein-Barr virus. So look into those. If you need help, if nobody will run that, let us know. Click the link down below. You can schedule that discovery call. We'll let you guys know how we can get blood shipped anywhere in the country. Jody Ann, metformin side effects. I've got a post on metformin on TikTok, hundreds of thousands of views and hundreds and hundreds of people commenting. And so that's where people have gone, and they're saying all the side effects. If you read through there, that it's digestion stuff. Some people, they'll see kidney issues, a lot of different things. So, read the label and you'll see a lot of what those side effects are. But here's the deal. If you are on metformin, your blood sugar is jacked up. Some way, somehow, your blood sugar is not right. That's why they're putting you on there, and you need to fix that. How do you fix that? Well, that's why I wrote my book, Blood Sugar Doesn't Lie. Brittany, go ahead and pop that link down below. You can grab that on Amazon. And it walks you through the process of how you fix your blood sugar. And this is what we do with patients every single day. We use a continuous glucose monitor, and we're able to track that blood sugar when it goes up too high, when it goes down too low, and we get it as steady as possible. If your blood sugar is higher than 110 or lower than 85, it's stressing out your body. You've got to get that stabilized. Again, what kind of doctor are you, please? This is T.S. Tandy, and any help with perimenopause? Yeah, absolutely. So all of the doctors here at F8, we practice what's called functional medicine, where we're looking to the underlying root cause, trying to get to that underlying root cause of what is actually going on. Why is the body out of balance, and what can we do for that? Perimenopause, one of the big things that you have to look at is actually the adrenal glands. The adrenals are our stress glands, and as the female body starts shutting down some of its estrogen production, the adrenals, the stress glands, they should be there to secrete a little bit and create some more estrogen in the body. But if somebody's chronically stressed, if their adrenals are depleted, you're not going to be able to do that. So absolutely. And then testosterone. How many of you guys give me a thumbs up or a heart out there if you're taking some type of external testosterone and think that that's just going to fix it? Your doctor's like, oh, here's the miracle. Well, guess what? That's not going to fix it either. You've got to fix the why deep down inside. All right, let's see. What could it mean if someone is constantly or consistently digesting food way too quickly? So if it's running through, if you eat some corn and you see it like 4, 5, 6 hours later, that is a hyperactive digestive tract. A lot of times that's a brain thing as well, where the body is just so anxious, so wound up. That digestive tract is just going to be so irritated. It could be spasms in there as well, just pushing everything along too much. But the first thing you've got to do is look at the microbiome, look at leaky gut, look at some of these underlying imbalances that you need to really work on to get that digestive tract working as well as possible. We have patients 20, 30 times a day, they're going to the bathroom, and if they are if they're not digging deep into the why, you can take enzymes or probiotics or all these things, but not get to the solution. Hey, Lisa, good to see you. I have Hashimoto's. Are there foods in a person should avoid that interact with my thyroid meds? So not necessarily that interact with the thyroid medication. So some people, they're told to wait an hour or two after taking their thyroid medication. I haven't seen it. Some people are like, screw it, I'm just going to take it whenever I want. And I haven't seen a difference in the amount of thyroid hormone in their body. But here's the deal. Hashimoto's, the food that you do want to stay away from is gluten. Gluten is the #1 food trigger for Hashimoto. So it has nothing to do with thyroid medication. It has to do with stimulating that autoimmune reaction in the body. So what does that mean? Well, when we start looking at this, it's called cross reactivity. So basically, you've got gluten and you've got your thyroid, and the immune system attacks gluten, but the thyroid looks so similar to it that it attacks the thyroid as well. And so we're going to drive this Hashimoto's reaction every time somebody eats gluten. And the problem is, if you have Hashimoto's, you're eating gluten, it's stimulating this reaction. Every time you eat it, it can last for up to 6 months, is what the research shows. So for me, some people are like, I need to know, I want to test a gluten allergy test and see what it is. But for me, I'm like, you know what? If you got Hashimoto's, get off of gluten. I don't care. We're not going to test. Don't waste your money. Just put that into getting better as opposed to knowing for sure. What would you recommend? This is from Need of Time. What would you recommend for someone that had a heart attack and has diabetes type 2? Here's the great news is that type 2 diabetes, people can reverse that. People can heal from their type 2 diabetes. The trick for that is to get a continuous glucose monitor. We give those to every new patient that we work with. And it's really simple. And if any of my patients are watching out there, leave a note down below of how easy it is once you start seeing it. So you do that monitoring, and you check it, and you go, okay, this food made me go up, don't eat that. This food made me stay good, eat that. I crashed down with that one, don't do that. So we absolutely need to be monitoring our blood sugar, and that's going to be if we can stop that, then we're going to slow down the inflammation, we're going to slow down the damage in the heart, all these different things. So great question there. So this is Camille. How can we strengthen adrenals? So this is a great question. And it comes down to this. I wrote another book, a brain book, Rebuild Your Brain, Stop the Damage, Start the Repair. Same thing. You can't just rebuild the brain without stopping damaging the brain. You can't just rebuild or strengthen the adrenals without stopping the damage to the adrenals. Two biggest stressors to the adrenals. One is brainwave pattern, the alpha wave, where you're in this chronic fight or flight pattern. That's why we do neurofeedback on so many of our patients. Number two is blood sugar swings. Every time that blood sugar dips down, you're revving up those adrenals and causing more stress in there. So yes, there's all those external stressors, but internal are the big ones. So you've got to stop stressing it to begin with, and then you can start strengthening it. Ashwagandha, phosphatidylserine, all types of different things can be helpful for it, but you've got to get it, stop damaging it first. All right. My doctor recommended a probiotic, Align. Thoughts on this product? Again, if all you're doing is taking a probiotic, that's not going to fix anything. If all you're going to do is eat some sauerkraut, that's not going to fix anything. You've got to dig deep. You've got to kill off. You've got to fix that gut lining. You've got to work on the liver. You've got to work on your brain and your adrenals and all these different things. So just taking a probiotic, you're not going to fix anything. Do you work with Dr. Cross in Las Vegas? I'm not familiar with Dr. Cross in Las Vegas. Is there any help for alopecia or hair loss after COVID? Yes. So if it's alopecia, that's autoimmune. The body is actually attacking those hair follicles. Some people, the hair loss, will actually see it from testosterone. I just talked to a lady yesterday, and she's losing hair, and her testosterone, she's on replacement, is spilling over into DHT in the blood work, and that DHT is actually going to cause hair loss. So if any of you guys are taking testosterone out there and your hair is falling out, you're probably taking too much. You're not processing it like you need to. There's some major issues. So is there any help for alopecia or hair loss? Again, it's inflammation. It got triggered after COVID. It's basically a symptom of long COVID, and you've got to calm down that inflammation. Look at your C-reactive protein in your blood work, your homocysteine. Look for autoimmune markers, ANA, rheumatoid factor, check Hashimoto's. You need to look at your blood sugar markers, ferritin, all these different things. Everything we do in our blood kit is what you need to get done, and then you're going to be able to tell what's actually going on. Let's see. Hold on a second. Have found digestive enzymes very helpful after gallbladder removal. So here's the deal. You're making up for something, not having a gallbladder or not secreting the bile like you need to. So you're making up for that by taking enzymes. Again, you're not fixing anything. One, you've got to make sure that you're eating the right foods, eating foods that aren't causing food allergies or sensitivities, that you're not creating just this chronic drip of bile coming out and eating too fatty of meals, processed things, stuff like that. So, enzymes can be helpful, but you've got to fix the why as well. This is a great question here. This is Robin. Ferritin on the latest blood work, 103. What is the optimal level? What's my one, for those of you that have watched me for a while, my number one favorite marker to test is what's called ferritin right here, Ferritin. If you have not been running your ferritin in your blood work, you need to get it done. So here's the deal. Ferritin, optimal for women, from 125 at the high down to 40 at the low. From men, 40 all the way up to 150. And that's because guys should have a little bit more iron. That's okay than women. But ferritin of 103 is okay. Ferritin low, if it is lower than 40, you are going to be dealing with some type of malabsorption, leaky gut. Could be a few other things, but it's usually a gut issue if your ferritin is low. If your ferritin is high, we usually see that with a lot of things related to inflammation. Your C-reactive proteins usually high, usually have high triglycerides, you're insulin resistant, metabolic syndrome, even the GGT for fatty liver is starting to creep up. And so if you have high ferritin over 125 in women, over 150 in men, you've got to look at that metabolic syndrome. You've got to look at getting a continuous glucose monitor and stabilizing that blood sugar as best as possible. So that is my favorite marker. That's why I brought that one up, Robin. That is awesome. Great question there. All right. We have Sosniak. Does diverticulitis or diverticulitis, I think you said that twice, prevent the absorption of medications? So it depends on the medication. But here's the deal. Whether it does or doesn't, you'll have to figure that out based on results of what you want the medication to do. But here's the deal. Your diverticulitis is fixable. The vast majority of people, if you do what you need to do, if you fix your leaky gut, if you change your microbiome, if you fix your stress response, if you work on your vagus nerve, all these things, diverticulitis can be reversed. Crohn's disease can be reversed. Ulcerative colitis can be reversed. Irritable bowel syndrome can be reversed. People have been doing that, giving their body the ability to heal all the time. So, I encourage you guys, absolutely keep going. So high B12, low ferritin. Yep. So again, low ferritin, look to leaky gut. Absolutely. Prairie tumbler designs. Yeah, a Prairie Tumbler Designs. Would your clinic work with someone in Canada? Absolutely. We have patients all over the world that we're able to work with, whether we drop ship the blood kit or you can get that blood work done up there. Either way, we can get that done. How much does the test cost? I live in Tennessee. So for all the blood work that we do, $260. If you walked in the lab, we've seen patients come back with $2,000 and $3,000 bills for the exact same blood kit. For us, we do it through a cash lab. We ship it out from wherever you are. If you live in New Jersey or if you come into the Tennessee office, we ship it out to the lab in California. Cash prices, they don't deal with insurance, so they're able to have, most of the tests are like 30 cents or $1 or whatever it is. So we get all these tests done, and then it's about $100 to see the doctor, and they'll do the exam, they'll do a brain map, and they'll sit down and let you know exactly what's going on as well, and if we can help you. This is Skater Girl. I've asked my doctor more thorough blood work, but because I'm young and healthy, they won't. Any recommendations? Yeah, again, what I was just talking about, we can drop ship that anywhere in this country and you can get it done. Unfortunately, the doctor's sitting there going, insurance probably won't cover it. You're probably going to have to pay out of pocket. You're going to come back and yell at me, or HR department, I'm going to get in trouble. So they're not even going to do that. normal ferritin, but low hemoglobin, normal B12. What can I do? So look at the MCV and the MCH. And if your MCV and MCH are high, then it's a pernicious anemia, and that could actually be an autoimmune disease. And again, normal ferritin, if your ferritin is under 40, it's not normal, and it still could be an iron issue. I've had autoimmune disease since 25, never lost hair until COVID. I'm a hairdresser. I know about hair. Yeah, so here's the deal. You got this inflammatory state created in your body. You've got to calm it down. I talked to a lady yesterday. She had filler put in, the hyaluronic acid filler put into her chin, and then she had it removed. It got it dissolved with something else, and it basically has stimulated this autoimmune reaction in her body. She's losing elasticity. She's in her 20s, losing elasticity of her tissues, all these different things. And so anything can stimulate that autoimmune reaction in the body. So it can definitely be pretty intense. All right. What type of diet do you suggest to support getting off Lexapro anxiety medications? Here's the deal. Especially we know for anxiety, every time that blood sugar drops, it's going to rev up the adrenals, and you're going to get this random anxiety. And so what you need to do is you need to get your blood sugar as stabilized as possible. You need to eat enough fat at your meals so you're not crashing down. You need to make sure you're not spiking, and then your body pulls it down quickly, because all of those things are going to cause more anxiety. So blood sugar stabilization diet is the best. What is that? Well, it's going to be unique for you. That's why we do the continuous glucose monitoring. All right, guys, I got to go see patients. I could literally stand here all day and answer these questions, but we do this every Thursday morning. And if you've got other questions, if you're on TikTok, pop those in the Q&A section. If you're on Facebook or YouTube, put those down below in the comments, and myself and my team will be getting answers to these questions as much as possible. Remember, if you're not getting the results that you need, if you're not getting the results that are going to give you your life back, if your doctor won't run blood work, won't help you down this path, then let us know. Click that link in the bio, click the link down below, and you can schedule a discovery call. We'll sit down with you, let you know exactly what the process looks like, how we can help you. If it looks like a case that is a good fit for us, for one of my F8 doctors or myself, we'll be able to go through and step by step through this process. We take people. We have a team that works with you all the way from a nutritionist to the doctor to, if you're in office, neurofeedback, all these different things to really get the body healing. And that's how we get the miracles all the time. So love having you guys on. Pop more questions down below. That's speaking of in the genetics, somebody asked about constipation. Is that genetic or inherited? I did inherit my parents and my grandparents' teaching. So I love educating. So if you guys have more questions, let me know, but we will talk soon. Take care.